6 vegetables that may be harmful to seniors, and how to safely replace them. Vegetables are an essential part of a balanced diet, providing vital nutrients, fiber, and antioxidants that support overall health. However, for seniors, especially those managing chronic conditions such as diabetes, kidney disease, heart disease, or those taking certain medications, not all vegetables are equally beneficial. Some may interfere with medications, worsen existing health conditions, or cause digestive discomfort. Understanding which vegetables may pose risks and how to substitute them wisely can help seniors maintain their health without missing out on essential nutrients. Eggplant, a hidden risk for bone health and medication interactions. Eggplant, a member of the nightshade family, contains a naturally occurring compound called solanine. While solanine is present in small amounts, it can interfere with calcium absorption and contribute to inflammation, which may be problematic for individuals with arthritis or osteoporosis. Additionally, solanine has been shown to interact with blood thinners, antidepressants, and certain blood pressure medications, potentially reducing their effectiveness. For seniors, maintaining bone density is crucial, especially for those at risk of fractures or osteoporosis. If eggplant is a staple in your diet but you are experiencing joint pain, stiffness, or are on medication that interacts with solanine, it may be wise to explore alternative vegetables. Zucchini, bell peppers, and pumpkin are excellent replacements, offering a similar texture while being gentler on the joints and free of solanine-related concerns. Cooking methods can also make a difference. If eggplant is consumed occasionally, roasting or grilling it with healthy fats like olive oil can reduce its potential inflammatory effects. However, for those with arthritis or taking blood thinners, it is best to limit or avoid eggplant altogether. Spinach, nutrient-dense but problematic for kidney stones. Spinach is celebrated for its high nutrient content, particularly its abundance of vitamins A, C, and K, as well as iron and calcium. However, it is also exceptionally high in oxalates, compounds that can bind with calcium in the body and contribute to kidney stone formation. Seniors, especially those with a history of kidney stones or kidney disease, may find that excessive spinach consumption increases their risk of developing these painful conditions. For older adults who enjoy leafy greens but need to be mindful of oxalate intake, alternatives such as kale, cabbage, and collard greens provide similar nutritional benefits with lower oxalate levels. These greens are also rich in fiber, which supports digestion and heart health, making them excellent choices for seniors. If spinach remains a preferred vegetable, moderation is key. Cooking spinach significantly reduces its oxalate content, making it a safer option than consuming it raw. Pairing it with calcium-rich foods, such as dairy or fortified plant-based alternatives, can also help reduce oxalate absorption and minimize the risk of kidney stone formation. Potatoes, a high glycemic risk for diabetics. Potatoes are a dietary staple in many households, but their high glycemic index, GI, makes them a less than ideal choice for seniors with diabetes or insulin resistance. High GI foods cause blood sugar levels to spike rapidly, leading to increased insulin demands and potential complications for those managing blood sugar control. Frequent consumption of high GI foods can contribute to metabolic disorders and increase the risk of type 2 diabetes progression. For seniors looking to maintain stable blood sugar levels while still enjoying starchy vegetables, there are several nutritious alternatives. Mashed cauliflower, roasted sweet potatoes, golden beets, and spaghetti squash provide similar textures while having a lower glycemic impact. These substitutes also offer a range of additional benefits, such as higher fiber content, which supports digestion and promotes sustained energy release. If potatoes remain part of the diet, preparation methods matter. Boiling potatoes rather than frying them reduces their glycemic impact, and consuming them with fiber-rich foods, such as leafy greens or legumes, can help slow blood sugar spikes. Opting for smaller portions and pairing them with healthy fats and proteins can further minimize their impact on glucose levels. Tomatoes, a source of acidity and digestive discomfort. Tomatoes are packed with vitamins and antioxidants, particularly lycopene, which supports heart health and may help reduce inflammation. However, Their high acidity can be problematic for seniors with acid reflux, gastroesophageal reflux disease, GERD, or sensitive stomachs. Frequent consumption of acidic foods can lead to discomfort, heartburn, and irritation of the esophagus, making it essential to find gentler alternatives. For those who experience acid reflux or digestive discomfort after eating tomatoes, switching to lower acid vegetables such as carrots, zucchini, or cooked bell peppers may be beneficial. These options provide essential nutrients while being easier on the stomach. Cooking tomatoes can sometimes reduce their acidity, making tomato-based sauces more tolerable when paired with alkaline foods like whole grains or lean proteins. However, if symptoms persist, reducing tomato intake and monitoring portion sizes can help prevent discomfort and maintain digestive health. Cabbage, a fiber-rich vegetable that can cause bloating. Cabbage is well known for its impressive fiber content and digestive benefits, but for some seniors, it can lead to bloating, gas, and discomfort due to its raffinose content, a type of carbohydrate that ferments in the gut. While fiber is essential for digestive health, excessive consumption of gas-producing vegetables can be troublesome, particularly for those with irritable bowel syndrome, IBS, or slow digestion. To enjoy the benefits of cabbage without the digestive discomfort, seniors can opt for cooked cabbage instead of raw, as cooking breaks down some of the gas-producing compounds. Other gentle alternatives include bok choy, steamed carrots, or zucchini, which provide fiber without excessive bloating. Pairing cabbage with digestive-friendly foods, such as ginger or fennel, can also help mitigate bloating. Eating smaller portions and chewing thoroughly can further ease digestion and reduce discomfort. Bell peppers, a potential allergen for some seniors. Bell peppers are rich in vitamin C, antioxidants, and fiber, making them a nutritious addition to the diet. However, they belong to a food group that can trigger latex fruit syndrome, a condition where individuals allergic to latex may also react to certain fruits and vegetables. Seniors with latex allergies or sensitivities may experience itching, swelling, or digestive upset after consuming bell peppers. For those affected, safer alternatives include cucumbers, zucchini, carrots, or sweet potatoes, which provide similar nutrients without the risk of triggering an allergic reaction. If bell peppers are well tolerated, consuming them cooked rather than raw can sometimes reduce their allergenic potential. If a senior suspects a food allergy, keeping a food journal and monitoring symptoms can help identify problematic foods. Consulting a healthcare provider for allergy testing may also provide clarity and ensure a safe, balanced diet. Conclusion: while vegetables are essential for good health, some may pose risks for seniors, particularly those managing chronic conditions or taking medications. Understanding how certain vegetables can impact health and knowing how to make safe substitutions can help older adults maintain a nutritious and enjoyable diet. By choosing alternatives such as zucchini instead of eggplant, kale instead of spinach, and sweet potatoes instead of white potatoes, seniors can continue to enjoy a variety of flavors while prioritizing their health. Cooking methods, portion control, and mindful food combinations also play a crucial role in making vegetables more digestible and beneficial. As with any dietary change, consulting a healthcare professional or registered dietitian can provide personalized guidance to ensure that dietary choices align with individual health needs. With thoughtful substitutions and mindful eating habits, seniors can enjoy a diet that supports longevity, vitality, and overall well-being.